All right. Listen, I want to welcome everybody here today, and I'm Dr. Josh Shields, and joining me today is Dr. Paris.
Good morning.
Hey, Dr. Paris. Listen, today we're going to be discussing hormonal imbalance, and I thought of who better than the hormone whisperer, and that's what she and that's what you've been nicknamed by many of our patients, is that you've helped a lot of people with their hormonal issues, and I thought it would be great to kind of pick your brain for the next 15, 20 minutes and find out, some of the experiences you've gone through, some of the patients you've been able to help, and exactly what is hormonal imbalance and what we do. And so one of the things that we're going to be discussing in particular is women. This is especially for women. If you're having troubles with heavy menstrual cycles, long cycles, and abnormally heavy cycles, if you notice that you have PMS, mood swings, those are all things that have been associated with hormonal imbalance, fibroid, cyst, endometriosis. Those are all the things that I know that Dr. Paris has been able to help patients with, infertility. And so let's just dive in. So Dr. Paris, in your experience now over the last 15 years in helping patients, that's right. How long have you been doing this now, this type of work?
I graduated in 2006, so this will be my 14th year, literally to the month, I think.
Oh, wow. And what do you feel like the first thing that somebody should know if they believe that they're suffering from one of those symptoms? Like, what's the first thing that they should address or know if they're having any of those problems we just listed out?
Well, I think the first thing to know for sure is that there is hope, that there is somebody out there that can help them. It is changeable. But I think the other area that gets oftentimes misconstrued is this idea that even though hormonal symptoms are incredibly common, they're not normal. And I don't say that to be callous or to vilify, but not every single woman that has a menstrual cycle has PMS or has fibroids or has a heavy flow. Not every single woman has difficulty getting pregnant. Not every single woman that goes through menopause has terrible night sweats and weight gain and hair loss and all of these other symptoms. So when a woman typically presents with a hormonal imbalance, it's usually because there are other systems that are also imbalanced that need to be addressed.
Yeah, it's funny. I just got off a consultation with a lady, and she had to have a complete hysterectomy
Mm-hmm.
at a very young age. And it's
Yeah,
like, why does that
so
happen?
common. Mm-hmm.
But nobody ever, and I said, did they tell you why you had the fibroids to begin with? She goes, no. And I was like, well, that's the thing we want to dive into, is what's causing these issues. And that actually leads us to the next question: is what, in your experience, has been probably the most common cause of hormonal related issues? If you
With
had one.
Whoa, if I had one,
Yeah.
I hate to be the bearer of bad news, but I'm going to use the word stress, which everybody loves. And I air quote it because people are probably rolling their eyes already. But when I say stress, that's all your stressors, right? So it is emotional stress. Emotional stress is going to play a huge role on your ability to have proper menstrual cycles. It affects your thyroid, it affects your adrenals, it affects your blood sugar. And having proper hormones is a little bit residual in a way. Like they're not entirely essential for our survival. So the body is always going to prioritize where the resources go. For a lot of patients, when I know you said one thing, but I'm going in a different direction
That's
for
all
a
right.
quick second. But a lot of the times when women come into our office, they're coming in for a hormonal issue. And oftentimes we won't even necessarily look at their hormones on that first visit because the hormones are metaphorically the tip of the iceberg. They're the part that's sticking out. You can see them. I mean, if you've got heavy cycles or you're not getting a cycle, or
Migraines, I forgot to mention earlier.
migraines, yeah, migraines, night sweats, hot flashes, of course, the heartbreak of not being able to conceive, all of these things, they're the part that's sticking out of the water. But using that metaphor of the iceberg, there's all of these things below the surface of the water, which I think functional medicine and naturopathic medicine is so wonderful at looking at, like you just said, of asking the questions, well, why though? And so looking at things like diet and again, stress. Stress is all the things below the surface of the water. So nutritional deficiencies, inflammation, food sensitivities, infections, poor liver detoxification. Those are kind of the stressors on your system. So when I say stress, yes, it's mental, emotional, physical, but there's also all of these other aspects that we need to kind of take off the body so that it can produce proper hormones.
Yeah, and I think also the environmental triggers as well. Like we've learned now that there's certain chemicals that mimic estrogens. They act like estrogens. They can cause that estrogen dominance.
Absolutely. The average woman is apparently exposed to over 1,000 chemicals every single day, everything from skincare lotions to mascara, shampoo, home cleaning products, not to mention all of the things that are coming through our water table, through the air that we breathe, through the food that we eat. So yeah, we're living in a pretty toxic chemical soup, and many of those are endocrine disruptors.
So with that being said, then how is it then that we're able to help patients? Because we're not eliminating the environment from their lives.
Mhm.
How is it that our care is able to help some people, even though they're still living this environment, this toxic environment? How
We're
does it work?
taking the stress off the system is my simple analogy. I use this idea of a metaphorical cup of water, and all of those things that we talk about with patients that I mentioned, inflammation, blood sugar, deficiencies, infections, they're individual drops of water in a bucket. And so if we can get rid of those things, there's just a lot more space within the bucket for the body to be in a better state of balance. But I think we also do a really good job of educating our patients on the things that they can be doing to empower their health, which is obviously living in a cleaner environment, getting home air purifiers, getting water filters, cleaning up their cosmetics. So I think we do a pretty good holistic approach in that way of dealing with all those additional things. And then of course, we can definitely tailor things to specifically look at their hormones.
Yeah, interesting. I remember the first time I learned about the stress connection in hormones, and just
Mhm.
even the emotional stress component. I still remember when a lady was telling me that her hot flashes went away when she started doing yoga.
Yeah,
First, I was like, "That's absurd." But then after you start thinking about it, you're like, well, you understand that the cortisol connection to progesterone and how that can play a role in your progesterone estrogen balances. And so you start looking at
absolutely.
the physiology, like, well, this does make sense. And I think one of the biggest takeaways I've gained though from what you're saying is when the one thing that we should understand about this is that we're not, it's not a hormone problem. It's an entire body problem.
You
Like I
got it.
was thinking today, this morning before I came to work, is so many times we talk about the mind body connection,
Hmm.
but really they're not separate. Like there is no connect. They are one, and
Absolutely.
we are one with our hormones. Like you can't take the liver out of the hormone equation.
No,
You can't take stress out of the hormone equation. You can't take your thyroid out of the hormone equation. Um, it's just endless. You can't take nutrients out of the hormone equation. There's
yeah,
just all these connections, and I guess that's what we're trying. That's the point is that there is. You got to look at the big picture, not just
you
a
got it.
singular piece,
Yeah, and I
not
think
the
that's
tip.
kind of where we do excel. You know, you can bring it back to the gut. I mean, everything kind of goes back to digestion, right? If you have friendly competition for resources, you've got bacteria, you've got parasites, you're not absorbing your nutrients, you don't have the proper engine to kind of fuel your liver, you're not detoxifying hormones, you're recirculating your toxins. I mean, it kind of goes on and on and on. And you know, there's been 1,000 books written about this topic, but I think that is the take home message, is that it's oftentimes not purely a hormonal problem. And so what does conventional medicine do? You're not getting cycles, here's the birth control pill. Your cycles are too often, here's the birth control pill. Your cycles are too heavy, here's the birth control pill. You're having a hard time with your kind of perimenopausal symptoms, here's the birth control pill, or here's HRT. And so it does serve a purpose, and I don't want to say that it doesn't benefit so many women to take the edge off, but it's not really answering the fundamental question of, well, why is that happening? Why are you growing fibroids? Why are you growing endometrial tissue? Why is it happening?
Tell me why you think it's a mistake that, or maybe it's not a mistake, but I know a lot of doctors when they're looking at hormones, they simply run a progesterone or an
Mhm.
estrogen panels.
Yeah.
Why? What are your thoughts on that? And what would you do differently, maybe?
Well, we look at a lot of blood work, and for anybody watching who's ever had a female hormone panel done, you'll notice that the ranges are huge. So, for most women, when they go the route of conventional medicine or they see an endocrinologist, they're typically told that they're normal, unless there is truly something pathologically happening or they fully have gone into menopause. It's really, really common to fall within those normal ranges. So, Yes, we look at estrogen. Yes, we look at progesterone. We'll look at testosterone. We also look at the hormones that are upstream in the brain, FSH, LH, prolactin. We'll look at thyroid hormones because those play an intimate role. We'll look at adrenal hormones, cortisol, DHEA, because that kind of paints a whole picture of what's going on. But looking just at the hormones themselves, I don't think gives us the whole picture. And I think with comprehensive testing, by running everything else, food sensitivities, digestive testing, stool analysis, thyroid, blood sugar, adrenals, inflammation, we get a much better idea of quote unquote where the stressors are on the system and where we can help.
Yeah, I think once again, you can't remove the hormones. The hormones are the effect of a healthy person in a sense. And I remember I was meeting with a patient, and she didn't understand that there was a connection between her diabetes and her estrogen.
Mm-hmm.
And and that's one of the things I said. Actually, your goal is not to have normal menstrual cycles. Our goal for you is to not be insulin resistant, because insulin is such a powerful hormone. It's affecting all of your other hormones.
Yeah.
And so as we get your body healthier and your body less insulin resistant, the insulin will come down. As the insulin comes down, then your hormones will be restored to normal balance, because you can't affect one hormone without affecting all of your hormones.
You got it. It's a cascade.
Yeah, and so that's some examples are we want to look at to see if somebody has diabetes. We always want to rule out too, as well, even if somebody's having menstrual issues, that we want to rule out the thyroid as being a possible culprit.
Mm-hmm.
Or adrenal stress, that cortisol levels are normal or efficient or deficient. Those could affect the hormones too.
Absolutely. And I think a big thing is running them often. That's one thing we really do in our office, is check those things throughout the course of the patient's care, because they're going to change. Sometimes when the thyroid gets better, the adrenals get a little bit worse, or they kind of go up and down in tandem. And so I think in conventional medicine, this idea of running a patient's hormones once a year, telling them that they're fine and sending them away, misses so much of the nuance that happens on a weekly, monthly basis that we can kind of tweak and support as things happen.
That brings to mind too, I know that you run a specific urine hormone test. Now, initially when I first heard about urine hormone testing, I have to be honest, I was a bit skeptical. But what have you learned since you started doing that test, and what do you think the value of doing a urine hormone test is versus a blood hormone test?
Well, they both have value, but blood looks at just the total amount of hormone in that moment in time. So let's take estrogen for an example. Estrogen in a woman's cycle is going to vary whether or not she's in the early part of her cycle, the later part of her cycle, or during menstruation. Of course, it's completely going to be different if she's peri or postmenopausal. With a hormone metabolite test, it tells us not only the total hormones, but also what the body is doing.
Stop. It's having a problem right now, so let's make sure.
Okay.
Oh, come on, don't do this to us. Let me close down some things. Okay, there it goes. Okay, I'm sorry.
That's okay.
You were saying?
The urinary hormone test, it's called a Dutch test. It's a dried urine test, and it looks at much more what is happening with the hormones versus just that static number of you're either good or you're bad. It looks at what the body is doing with those hormones, how you're able to break them down and get them out of the body. We hear this idea of too much estrogen or estrogen dominance. The relationship of hormones to one another is also very important. So the relationship of estrogen to progesterone is important. The types of estrogen are really, really important. And
that test will tell you the types of the estrogens?
It will. So there's 3 different types. For the sake of simplicity, we'll call them, red, yellow, and green. You don't want to have a lot of red estrogen because that is a lot more proliferative. So it can lead to things like cancer, DNA damage, fibroids, endometriosis, growing things. And then you want to have a lot of green estrogen, because that green estrogen is a much more of a protective estrogen. So if a woman is not metabolizing properly and is putting the bulk of her estrogens towards the red estrogen, then there's a lot of things that we can do in order to shift that pathway so that she's producing more of the green.
And you said this earlier too. You said something about breaking down or metabolizing. Please
Mhm.
explain that a little bit more because I don't know if that's going to be clear to everybody. What do you mean exactly by metabolizing or breaking down estrogens?
So our body makes estrogen, obviously in our ovaries. We also make a lot of it in our fat cells. And so the body does a few different things with estrogen. The first thing it does, it brings it to the liver where it goes through a whole bunch of different pathways. Basically, it goes down an assembly line where it gets broken down and then it gets dumped into the bowels to be kind of pooped out into the external world. There's also a
Okay.
few other things, which is why constipation or digestive health is really an important part of hormonal health. If you are having an overgrowth of bad bacteria that are then sticking those estrogens back together again, kind of like Legos, your body has to work really hard to break those down yet again. So if I could get a question there.
I was just thinking, so basically what you're saying is when somebody has a constipation issue, they're more likely to have this estrogen dominance type of thing. So,
They're
and,
more likely to have hormonal issues, absolutely, because they're
and I was th-
burdening their liver.
and I was thinking of acne,
Yeah, yeah.
and I guess that might be one reason why when we're going through puberty, we
Mhm.
have a lot of hormones, so we're not getting rid of them as well as we should or
Yep.
could, especially because
Well,
our diets.
think of an adolescent's diet exactly, right?
Yeah, and so if we're not eating the right foods, we're not clearing those hormones out. But then obviously, if somebody has constipation, because I've heard it said too before, anytime you have a patient that's constipated, always think estrogen dominance,
Absolutely.
or at least consider it as
And
a
it can become a bit of a back and forth cycle because one thing that we forget with hormones is that we have hormone receptors not just in areas like our uterus, but we also have it in our breast tissue, we have it in our brain, we have it in our digestive tract. So constipation and acne are very interrelated. Constipation and estrogen dominance are very interrelated. Low thyroid function and constipation are very interrelated. And so we see these patterns in our patients.
How important do you say it is that patients are taking the right supplements to help balance their hormones? Like, because I know a lot of people are out there, they're trying, I know that me included, I've always tried to do everything with my diet and my lifestyle.
Yeah.
And how important would you say that the supplements or the recommendations that you've given people for their hormone balance, how important do you think that is to the equation?
I think it is really a non-negotiable. Um, we can be really utopian and say that we can get everything from our diet. But it is also really important to know what it is that you're balancing. Most of the patients that come into our office have a little grocery bag or a small home apothecary full of so many things they've tried, whether it's rhodiola for their adrenals or Vitex for their hormones or this or that. But it is guessing. But the hormones are really there to support our physiology. Herbs are one form of medicine that have been used for hundreds of years to get nutrients, but even just basic cofactors like fish oils, magnesium, vitamin D, these are things that we are all deficient in. And unfortunately, even if we're eating a perfect diet, are just not getting enough of based on our physiological demand.
Got a question for you.
Yeah,
Out of the patients you test, out of let's say 100 patients, how many of those will have nutritional deficiencies?
at least one nutritional deficiency, 100%, all of them.
Okay.
Mhm.
And that's important because in relationship to hormones.
Absolutely. So
Why?
magnesium next to vitamin D is probably the most common deficiency that we see. And we need magnesium for at least 350 different reactions in the body. So everything from detoxification in the liver, everything from moving the bowels, relaxing the nervous system if we're talking about stress,
Okay.
insulin sensitivity. So everything from magnesium, vitamin D, zinc, B5, B6, iron, and you asked why it's important. The analogy that I use with patients is at the end of the day, if you don't have gas in the tank of the car's not going to run. So you're asking your body to make hormones, but you didn't put anything into it to help it along.
Okay. Thank you. Um, how important is diet to helping somebody balance their hormones?
It's probably the most important, and it's probably where I get the most eye rolls. And
Yeah.
it took me a little while to figure this out, to be honest. I really, really, really feel, and I can say it clinically now after this many years, that a patient who is eating well, and I'm not just saying well, but they're eating really well, is going to do better they're going to see improvements faster, and they're going to maintain their gains much better than somebody who's doing so-so and who's taking a ton of supplements. So while the supplements are there to support your physiology, I feel like without the proper diet, they're not as effective.
What is a good hormone diet per se? Let's say if I'm watching this right now and I'm trying to figure out, like, what should I be eating or what should I not be eating? What would you recommend? Or what would you suggest to somebody that needs
A
to maybe?
whole food-based diet, high in protein, really high in plant nutrients, low in inflammatory foods, low in processed foods. Those processed foods with all those additional ingredients, a lot of those are chemically laden. So it's just one more drop of water in that metaphorical bucket that your body now has to break down. And if it's breaking down all of those things, it's not breaking down your hormones. So vegetables, low amounts of carbohydrates, rice, quinoa are fine, low starchy veggies, lots and lots and lots of protein. You need your body to have a lot of protein in order to not be in a breakdown state.
Got it. When somebody's working with a naturopath or with a holistic practitioner or a functional medicine practitioner, what do you think is important for them to look for?
I could get into the idea of, making sure they graduated from an accredited school, looking at their education, looking at their experience. Fundamentally, I think what it comes down to is the unquantifiable, which is making sure that patient feels like that person feels like it's a right fit for that person. And
Yeah,
sometimes you just know. When you walk into a room, I can tell you typically within 1 minute whether or not a patient's going to do well in care. And they can probably tell you within a couple of minutes whether or not I am or am not the right fit for them. So I think that there's a feeling to it.
beyond
That's
feeling.
a little bit woo-woo, I know.
Yeah, no, no. I mean, listen, I always tell people too is if you're not feeling it, if you don't feel that this is the right place or we're the right doctors, then we're not. You need to keep looking until you do find the right feel. Beyond the feeling aspect of it, what are some of the tools or some of the resources, or as far as when they're meeting with the doctor? I know that we've had some people that have they go and they meet with the doctor, and 5 minutes later they walk out and they have a bag of supplements. To me, that's a red flag,
Mm-hmm.
because how do you know what the patient needs without really doing an adequate workup on the patient? So for me, I would think that one of the things is, are they looking at and testing to see what you actually need? For me,
That's honestly a perfect answer, is how are they establishing a plan as far as what they're doing. And again, I think, yes, we do use vitamins, minerals, and herbs, but they're used in a very systematic way in order to tailor it to the patient. So hormones is a great example. Never in 14 years have I given a patient a supplement for their hormones on that first visit. We're working on all of the things that we just talked about: diet, digestion, nutritional deficiencies, inflammation, blood sugar. And the beauty is that for a lot of patients, even before we get to the place where we would begin working on their hormones, they get a menstrual cycle and it's like, wow, I got my period and I didn't know it was coming. Or it was super light, or it wasn't as heavy. I didn't have to stay home from work. I didn't have to call in sick. I could play with my children. And we haven't even touched their hormones yet. But yet, as a side effect of doing all the other things, they're already beginning to improve.
this is going to be a tough one for you. But when you first graduated school, you
Yeah.
came out, you were started helping patients. If you can look back at Dr. Paris 16 years ago, and now you look back at what Dr. Paris was doing then compared to
14.
now, 14, what would you say the difference in your approach has been, or how have you evolved, and how did you become the hormone whisperer? Did you just start out of the gate as a hormone whisperer? I mean, tell me.
No, I think it kind of evolved. I think you fall into whatever falls into you, and you see what you see based on what people need. I think the biggest thing that's evolved is truly my belief in the importance of the diet and in managing stress. I think when I started practicing, if a patient's diet was okay, we didn't really tweak it that much. They were still eating vegetables. Yes, they had pizza here and there, but it wasn't terrible. They weren't eating fast food three times a day. But I really have seen in my patients that the ones that work really hard at the diet are the ones that do the best, and the ones that stay with it consistently over time, work at it, and just becomes part of what they do and who they are. are the ones that do the best. And so I drive that home with patients, and it's honestly, it's boring. It's not easy. It's not exotic, but it's what we should be doing. And it's also hard work. And to be honest, that's probably why I shied away from it for as long as I did, because it really is tough work to fine tune that.
I'm scared to ask this question because I've got a new patient I've got to talk to in a second, but why is the diet so important again for the people out there that are watching this? Like, why is diet so important to their hormones? Like, I know we talked about it, but why is it? If you can sum that up.
I'm going to sum it up with an analogy that
Explain
hopefully
it.
works. So the supplements are basically, they're wonderful, but they essentially are like fancy window frames on a house that has no scaffolding if you don't have a diet in place. They might work a little bit, but they're going to be so much more effective when the diet is in place, because the diet is where you are getting not only all of your nutrients, but if you're not eating well, you're constantly adding more inflammation to a system that is already burdened.
So the foods can be inflammatory.
Absolutely.
And
Dairy,
damaging.
sugar, wheat, processed foods, genetically modified foods have the potential to undo all of the good that you're doing. I mean, we hear this all the time for patients that have been on a weight loss protocol, right? They do great Monday through Friday, they lose a couple pounds, and then it's Friday night, they go out with the coworker for nachos, and then they gain back the 5 pounds that they've lost. And then they do it again the next week. And it's that one single cheat that is so minimal in the grand scheme of all the other meals they've had in a week that can set them back a full 6 days. So that's, I think, a great example of how powerful food can be.
Okay. That's awesome, Dr. Chris. I appreciate your time today, and I
Awesome.
certainly hope it can help somebody out there. And I'll talk to you later.
Yeah, to be continued. Bye. Thanks.
Bye. Take care.